Okay, so have you ever been stuck in that healthcare limbo? Like drowning in paperwork. You're thinking, this system is insane.
Yeah.
We've all been there,
That's a
right?
common experience, unfortunately.
What if I told you there's this group, they're called the Healthcare Reinvention Collaborative or HRC, and they're actually doing something about it.
Yeah. They're not just talking about it,
They're actually building a better future for healthcare,
which is so refreshing because there's so much talk
right?
uh, about healthcare problems. But HRC is all about how do we fix it? How do we move forward? What are the solutions?
Exactly. And you are in luck because we have kind of this fly on the wall view in this deep dive.
Mm-hmm.
We're looking at one of their member meetings.
Yes. Like we're right there in the room with them.
So it's like insider access to how this change actually happens.
And it's not just talk. That's what I think is so unique about HRC. It's like, how do we put action behind these ideas?
Yeah, totally. And right off the bat, they're describing themselves as a two-loop model. And I don't know about you, but when I first heard that, I was like, buzzword.
Right. Is this going to be another jargony?
Yeah, exactly. But it's actually super important for understanding their whole approach.
Yeah.
Because they're acknowledging that the old system is still here, it's still going with all of its problems. But a new system IS emerging, which is ideally more collaborative, more patient-centered.
It just makes more sense.
Yes.
Oh, fine.
So they're saying, okay, we're working within this old system, but we're also building this new thing.
Yeah, it's like we're building the bridge while we're walking across it.
Ooh, I like that.
And the people that HRC is really focused on connecting with, they call them ruckus makers. They're the ones who are on the ground, putting the bricks in place.
Okay, ruckus makers. I love it. So who are these ruckus makers? Is this doctors? Is this nurses? Who are we talking about?
It's such a diverse group. It's really anybody who's trying to make a difference in healthcare. So it could be doctors, nurses, entrepreneurs, technologists, patients even.
Okay.
And to understand who they are better, HRT did this really cool thing where they created an empathy map.
Okay.
And it's basically like getting in the shoes of a ruckus maker and trying to understand what are they thinking, feeling, experiencing.
So probably a lot of frustration.
Oh, yeah, for sure.
Yeah.
I mean, these are the people that are on the front lines. They're seeing where the system's broken down.
Right, exactly.
And they're feeling it.
Yeah.
The empathy map highlights feelings of being overwhelmed, isolated, swimming upstream.
Yeah.
One of the quotes from the meeting was, "The system is broken. We need a unified change."
It's real.
That's how these ruckus makers are feeling.
But I have to imagine it can't all be doom and gloom, right?
No.
Because you don't become a ruckus maker if you don't have some hope.
Exactly. And that's what I think is so interesting is, yeah, there is frustration, but these ruckus makers, they're incredibly driven. And they're really looking for that sense of collaboration, that shared purpose. And they believe that, we can make a difference if we work together.
So it's HRC's job to kind of connect those dots and be that spark.
Exactly, to fan the flames of that passion that these ruckus makers already have.
Okay.
And it's not just about warm, fuzzy feelings. It's how do we turn this passion into action? How do we get stuff done?
Yeah, and they do that by highlighting these ruckus makers in their meeting. They talk about Aladad, ChenMed, Nuka.
Yeah.
So what are these groups doing?
Yeah, so Aladade, they're revolutionizing medical devices.
Okay.
ChenMed is tackling healthcare disparities.
Interesting.
And then Nuka is really trying to reimagine how we even deliver primary care.
So it's we are seeing these stories of change. It's not all bad.
Right. Exactly. That's the energy that HRC wants to amplify. I mean, these examples we're talking about, these are just the tip of the iceberg.
Right, right.
And HRC isn't claiming to have all the answers. They're not trying to reinvent healthcare all by themselves.
No, definitely not.
They're creating kind of a platform, a launch pad for these ruckus makers to connect and collaborate.
So how do they actually do that?
Yeah, how do we get from this idea to actually making a difference?
Yeah.
And I think this is where our insider access with this meeting transcript is really cool because we get to see how HRC is going to turn this vision into action.
Okay.
And they're starting with how they're actually structured. They're becoming a social purpose corporation.
Okay. So what does that mean? Break that down for me.
Yeah, so it's kind of like a hybrid between a for-profit company and a nonprofit.
Okay.
It gives them the flexibility to generate revenue like a business would.
Okay.
But they're legally required to put their social mission above profits.
Yeah. I see. So they can put their money where their mouth is?
Exactly.
Yeah.
And it signals to everybody that they're serious about this.
Yeah.
This isn't, a flash in the pan. They're here for the long haul.
They're committed.
Yes.
Okay, so they're structured in this really unique way. What are some of the other actions that they're taking?
Yeah, so one of their main strategies is hosting these events, but they're not your typical, healthcare conferences.
Okay.
These are really focused workshops that are designed to generate, tangible solutions.
So it's less talking, more doing.
Exactly. Yeah, they're creating a space for brainstorming, problem solving, and actually fostering those connections between ruckus makers.
Yeah, because we were talking about that feeling of isolation, right? That came through in the empathy map.
Absolutely. And, they heard that and they're like, okay, we need to create a space where people don't feel that way.
Yeah.
So they're building this online community platform. And this is really cool because it's like a virtual hub where HRC members can connect with each other, share resources, even form subgroups.
So it's like a movement within a movement almost.
Yeah. And they use this phrase, networks of networks, which I think is really interesting.
Yeah, that makes sense.
So let's say you're really passionate about improving mental health care access in rural areas.
Okay.
You could find other ruckus makers on this platform that are passionate about the same thing, and you could create your own little mini movement within HRC.
So they're taking all that energy, all that passion, and focusing it.
Exactly.
That's just so cool. And it's not just a future thing, right? They're already doing that. They have that Illuminate Ruckus Makers thing on their website.
Oh yeah, absolutely. They're already highlighting the work that these innovators are doing right now.
Yeah.
Sharing their stories, providing these concrete examples of what's possible.
And just seeing that, it can be so inspiring, right?
Absolutely. It's like, okay, if they can do it, I can do it.
Exactly.
Yeah, that gives you that little spark.
Yeah, totally.
So yeah, they're building a community, they're supporting these innovators, and they're creating this really kind of action-oriented environment.
Okay, so what's next? What else is on the agenda? So we've talked about the two-loop model, the ruckus makers, and how HRC wants to help them collaborate, but there's one more thing we need to, unpack here.
Yeah.
And it's a big one, this impact network map they keep mentioning.
Yeah, this is where things get really, really interesting.
Okay, tell me more.
So imagine, a giant web that shows you all these ruckus makers and what they're working on.
Okay.
That's the impact network map.
So a social network, but for healthcare.
Exactly.
Yeah.
But with a purpose, right?
Right.
It's not just about connecting with people.
Yeah.
It's about finding those strategic connections.
Okay, I like it.
So they have, two views of this map. The first one is geographical, so you can see where all these change makers are, physically located.
Okay, so I could see, there's a ton of people in, rural Montana that are working on, access to care.
Exactly.
Interesting.
And then you can even see, are there any gaps geographically where there's not a lot of innovation happening?
Right.
But it gets even cooler.
Okay.
Because they have this second view that maps connections based on shared interests. So let's say you're really passionate about, I don't know, using AI to improve diagnoses.
Okay.
You can find other people on this map who are working on the same thing, no matter where they are in the world.
That's so cool.
And HRC gave this really cool example in the meeting.
Okay.
Where they connected Kieran, who's doing amazing work on maternal health, with Mindy, who has this expertise in community outreach.
Okay.
Because they realized that, Mindy's network plus Kieran's on-the-ground experience would be this amazing, powerful combination.
Wow, it's like matchmaking, but for healthcare innovation.
Exactly. And the map isn't static. It's constantly evolving as more ruckus makers join HRC.
Oh, that's smart.
So, it might reveal, there's a gap here around, chronic pain management. And HRC can be really strategic about connecting people in that space.
It's like they're creating this this movement, this force that's bigger than any one person or organization.
Exactly. And it's really exciting, when you think about the potential for this kind of network.
It's huge.
And it goes back to, why should you care about all of this? Why is this important?
Yeah.
Because HRC is building this for everyone. It's not just for them.
Okay.
It's for anyone who's ever been frustrated with healthcare and felt like, I wish there was something I could do.
So if you're listening to this and something is resonating with you, you feel that spark.
Yeah.
You want to be part of the solution.
Check out HRC, explore their website, dive into their community.
Yeah, you might just find your people, your purpose, even your next big breakthrough, right?
Exactly. Because you never know where these connections are going to lead.
It's all about making those connections.
Yeah. And who knows, maybe you'll be the next ruckus maker that we're talking about on this show.
Exactly. That's it for this deep dive on the Healthcare Reinvention Collaborative, or HRC.
Such great work they're doing.
It's really inspiring stuff. We'll put links in the show notes to everything we talked about so you can check it out yourself.
Definitely worth a look.
Until next time.